Please welcome into the iHeart Communities studio on Community Access, Dr. Jennifer Logan to represent Jefferson Radiology. How are you?
I'm great, thanks. How are you?
Excellent. I'm so happy you're here. We're creating awareness for breast cancer research. We're creating awareness to get your exams. Early detection is the key. I don't know if you even know this. My grandmother was a 2-time breast cancer survivor for 49 plus years.
Amazing.
I had my surgery when I was 20 years old. So this is a subject that's very near and dear to my heart and my family. So thank you for being here today.
I'm thrilled to be here. Thanks, Renee.
What do we need to know? How can we help?
So what we need to know is that all women over 40 should be getting a yearly screening mammogram at a minimum. Okay, so October is our big push month for that. We're trying to get awareness out for women who haven't had a mammogram, who maybe have put it on the back burner for multiple good reasons like work, family, life, things that get in the way of getting these appointments done.
That's what women do. We don't put ourselves first, and then we're usually 9 times out of 10, not to stereotype, we're the caregivers.
Correct.
And we need to take care of ourselves.
Exactly. So we're trying to get women to come in, take the time to get that mammogram. Nobody enjoys it. It's not a fun exam, but it is a very important exam. We pick up a lot of early cancers with mammography. And early detection is the key to successful treatment and potentially cure.
Well, and it's one of the diseases where if found early enough, there's a very good outcome. We don't say that in every case, obviously, right. But I mean, your chances are so much better. And why wouldn't you want to do that for yourself? Where can we get more information about you, your work in Jefferson Radiology?
Yes, we have a website. The address is www.jeffersonradiology.com. On the website, patients can find information about our physicians, sites, office hours. They can also request appointments through the website.
And now this is something that people can go and check on. They can get, obviously, like you said, the locations and maybe even get an appointment or get information about that. You might have mentioned off mic, and I don't know if we could talk about it now, but do you have some changes coming or something exciting for your consumers?
We do, Renee. We're developing a new women's imaging microsite within our Jefferson Radiology website, which is going to have a lot more interactive material for patients, links to websites such as the American Cancer Society, things about breast imaging, breast cancer websites.
And also, I'm just wondering if there's going to be an area where they can find out what are some of the questions they should be asking their doctors or their gynecologists or their healthcare provider when they go in, to find out about their breast care and their breast health.
Right. Well, they want to keep track of how often they're having their screening tests done, which can be difficult to keep track of a yearly exam. They also want to consider their own personal risk for breast cancer, which is different for every woman based on family history, breast density, prior history of certain types of biopsy results. So those are important things to talk about with their provider, and it might impact what types of screening exams they would have and how frequently they'd have those tests.
We want to thank our guest today, Dr. Jennifer Logan from Jefferson Radiology. We appreciate your time in creating more awareness because we want to keep our ladies around for as long as we can. And we have to make sure we remember that, you want to take care of everybody else, but you can't do that job that you want to do if you are sick yourself. So, I think that's a good lesson to leave with everyone today, right?
Correct. Thanks so much, Renee.
Have a great day.
You too.